It has been, since January, our pharmacists all across Ontario have been providing these services that have been very much an easing of access to care in Ontario, and we've been really very proud to do that. I'd like to thank Mohammed, who's our owner here at the East Mall location, and all of his team for welcoming us this morning. I'd now like to invite Minister Jones, Minister of Health for Ontario, to address the crowd. Thank you.
Well, thank you very much, Jeff, and good morning, everyone. It is great to be back here in Etobicoke to talk about our government under the leadership of Premier Ford and how we are connecting Ontarians to more care close to home at their local pharmacies. I want to thank the Shoppers Drug Mart team for hosting us again this morning, as well as Justin Bates, the Ontario Pharmacists Association, and all of our pharmacy partners, for all you do to provide care to patients right in their communities. Pharmacies play an important role in connecting people to high-quality, reliable care right across Ontario. And with nearly 5,000 pharmacies operating across Ontario open late at night and on the weekends, they are one of the most convenient places for Ontarians to access the healthcare system. That is why we are very pleased to announce that today our government is adding 6 more of the most common medical ailments to the list that pharmacists can treat and prescribe certain prescriptions for. These 6 new ailments are acne, canker sores, diaper rash, yeast infections, parasitic worms, and nausea and vomiting during pregnancy. These 6 common ailments are in addition to the 13 pharmacies have had the ability to provide treatment for since our government announced changes in January of this year. Over 89% of pharmacists across Ontario are participating in this program, and over 400,000 assessments have been made since the start of the year. And I want to thank every single pharmacy that has participated in this initiative for your partnership in making it easier for people to connect to care across Ontario. Pharmacist prescribing has been a huge success in our province. In less than 1 year, Ontario has become one of the leading jurisdictions in all of Canada in providing healthcare services through pharmacies. And once again, I want to be clear, to access this service, all you need is your OHIP card, never your credit card. Under Premier Ford, that will never change. Taking action to strengthen all aspects of the healthcare system to make it easier for Ontarians to access care in the right place in their community. It is a key part of our government's Your Health Plan, and we are already seeing results. Surgical and diagnostic wait lists and wait times continue to decline. Since January of this year, we have seen a 180,000 person reduction in the backlog of surgical cancer screening, and the overall surgical wait list has declined to below pre-pandemic levels, with nearly 80% of all Ontarians receiving their surgery within the target time. Ontario is leading the country, with 70% of Ontarians having access to a primary care provider. And we are connecting even more people to primary care with our historic expansion of allowing for new interprofessional primary care teams across the province. There have been over 12,000 placements from hospital to long-term care, providing patients with better, more appropriate care in a setting that meets their needs. We are getting shovels in the ground for over 50 hospital development projects. And we have set a new record with 15,000 new nurses registering to work in Ontario this year alone, the largest number of nurses added in 1 year to date, with 30,000 more nursing students currently enrolled in Ontario's colleges and universities. Connecting you to more care at your local pharmacy is another way our government is building a convenient, patient-focused healthcare system for years to come. Thank you to all of our nurses, doctors, personal support workers, pharmacists, and the many other incredible healthcare professionals for all you do to provide exceptional patient care in your communities every single day. Thank you. Stay well.
Just please come form a line behind the microphone. And just a reminder, it's one question, one follow-up.
Thank you, Minister. Thank you for taking my question. I'm Steve Ryan from CP24. Are there plans to reopen any of the emergency departments that have been closed in the province? Are there any future plans for that?
So as we see temporary reductions in emergency departments, it's, as I've said many times, it is concerning for the local communities. But we have been able, by working with Ontario Health, by working with the local hospital leadership, been able to make sure that we have emergency department coverage for all physicians, so that gap, if a local hospital is unable to find a physician who can cover those hours, we've been able to work with Ontario Health to match individuals who will come in and temporarily cover those roles. And then all of the work that we're doing, expanding the other primary care individuals who are part of those emergency departments. So whether it is the nurses, the respiratory therapists, the paramedics, who, again, we have expanded their scope of practice to allow them to help out more. All of that work together is ensuring that we make sure when those temporary hours have been happening, we work directly with the local leadership to help and assist as much as we can. One very specific example, we have a program called the Nurse Preceptor Program, which essentially matches nursing students with more experienced nurses and gives them experience right in the facilities. In Windsor alone, we've had 200 nurse preceptors being able to tap into one single program. So all of these pieces together are ensuring that we have the health human resources that we need wherever it is, whether it's in long-term care, in our community care through our paramedics, or here in pharmacies.
Thank you for that. And my follow-up, given the large protests that took place outside of Queen's Park last week regarding cuts to healthcare, privatizing some of the healthcare, is your government paying attention to that, and is that at all going to affect your decisions moving forward?
Well, I mean, I think you have to look at the numbers, and the numbers clearly show that not only are we expanding access to primary care through a primary care expansion that is ongoing right now, whether we are expanding access through scope of practice for nurse practitioners, for nurses, for pharmacists, we're actually making a public healthcare system stronger and more robust. What we saw previously was governments who were cutting residency spots so that physicians who were training were not getting access to those residency positions. The expansions that we've made, whether it is in education, whether it is in capital builds, whether it is in different programs that have ensured that people have access, that's what people should be looking at and saying, have we seen an expansion in the healthcare system in the province of Ontario, publicly funded through your OHIP card? Absolutely we have. And we should be proud of those expansions because we had a system that was very much under strain.
Thanks, everyone.